Good afternoon, and thank you for joining us today. Here is our latest update on COVID-19 for Pennsylvania. As of 12 a.m. this morning, we have 1,145 new cases of COVID-19. This brings our statewide total now to 26,490 Pennsylvanians that have tested positive for COVID-19 in all 67 counties in Pennsylvania. Approximately 1,327 of our total cases are now in healthcare workers. Tragically, we have now had 647 deaths among those who have tested positive for COVID-19. And to date, all of the deaths have been in adult patients. As of noon today, hospitals are reporting that approximately 2,392 Pennsylvanians are currently hospitalized due to COVID-19. This is about 10% of our total count, and this number has been very stable. 662 of those hospitalized have required the use of ventilators or breathing tubes. Across our healthcare system, approximately 41% of hospital beds, 39% of intensive care unit beds, and nearly 70% of all ventilators are still available. We have been working to get more refined and accurate data on one of our most vulnerable communities, those living in long-term care living facilities such as nursing homes and personal care homes. Our team has done a quote-unquote deep dive into the information provided by facilities, laboratories, and healthcare providers, as well as information from our response teams. As a result, our case count of impacted facilities and cases in these facilities has increased substantially. Today, we are able to report that we have 3,316 cases of COVID-19 in 297 distinct locations in 33 counties. Again, these are our long-term care living facilities. A county-by-county breakdown of this data is now available in the data section of our website at health.pa.gov. 324 of our total deaths, or approximately half, have occurred in residents in these long-term care living facilities, such as nursing homes and personal care homes. We continue to work closely with these facilities to provide infection control support and personal protective equipment. We must remain vigilant on two fronts to help protect this vulnerable population. First, the Department of Health, coordinating with the Department of Human Services, are working closely with all long-term care and personal care facilities to make sure that they have what they need to continue to care for patients and protect as much as possible, again, this vulnerable community. Second, we all have to continue our social distancing efforts. The Pennsylvanians who provide care to this community and the residents in long-term care living facilities need you to stay home to stop the spread of this dangerous virus, COVID-19, in Pennsylvania. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come in contact with others. These everyday prevention measures can help slow the spread of this dangerous virus, COVID-19, and give hope to our families and our communities that we will recover together. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494, or again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I would like to turn things over to Governor Tom Wolf. Governor?
Thank you, Secretary Levine, and thank you all for joining me. I want to make a special thank you to our sign language interpreters today. They're from the Office of Deaf and Hard of Hearing, and I'm doing this in honor of American Sign Language Day. So thank you for helping us communicate to all Pennsylvanians, including those who have trouble hearing. Now, we're continuing to have success flattening the curve thanks to many Pennsylvanians who have made the choice to stay home. And our medical personnel continue to do an excellent job caring for the surge of COVID-19 patients that we are now seeing. Today, I want to highlight the efforts of another set of Pennsylvanians, the workers who are ensuring we have the things we need to survive. This includes grocery store workers, delivery drivers, warehouse employees, truckers, manufacturing workers, and farmers, as well as the many, many other Pennsylvanians who are providing critical and emergency services, such as power plant workers, plumbers, and veterinarians, just to name a few. I speak for all of Pennsylvania when I say thank you for your hard work. Thank you for keeping our lights on. Thank you for keeping our refrigerators stocked. And thank you for keeping us safe. I've asked all Pennsylvanians to show our gratitude by staying home as much as possible. And as Dr. Levine said, wear a mask if you must go out. But you deserve more protection. Today, Dr. Levine signed an order directing businesses to make certain efforts to implement social distancing tactics. And this includes ensuring break rooms and meal areas have enough space for employees to stay at least 6 feet apart, prohibiting non-essential visitors from entering the premises, making signs and information available in the language spoken by employees, conducting meetings and trainings virtually, and mandating that employees wear masks while working. The order also requires businesses to take certain actions if the workplace is exposed to a person who is a probable or confirmed case of COVID-19. This includes implementing temperature screenings and sending home employees with fevers. It includes closing off, ventilating, cleaning, and disinfecting all workspaces and areas that person had used. And it includes notifying employees who were near that person. Finally, it dictates protocols to protect employees and customers alike in retail establishments that have remained open. These are common sense actions like cleaning off carts and hand baskets that most employers have already implemented. As I've said many times, we all have a role to play during this crisis. Our essential workers have stepped up to the plate and are keeping us safe, healthy, fed, and sheltered during this time. And we all need to thank them for doing everything we can to prevent ourselves from spreading the virus to them. That's how we thank them. We need to stay home. We need to wear masks if we go out. We need to wash our hands and to cover our coughs and sneezes. This will help us keep essential businesses open and operational. And it's the right thing to do to protect the people who have done so much for us. We're also working to protect other groups of people who are especially vulnerable to the spread of this novel coronavirus. Many of us have seen the data from other states that show minority communities have been disproportionately affected by COVID-19. And we know of instances in Pennsylvania where major outbreaks have occurred in vulnerable communities, including ones where people do not speak English. We are working to improve our data collection so we can get a better statistical understanding as to how the virus has affected different groups of people. And the Lieutenant Governor will be chairing a new health disparity task force that will work to identify short and long-term consequences of the COVID-19 pandemic in our vulnerable communities. By working proactively, leaders of different communities across our Commonwealth, working with those leaders, we can better ensure that nobody gets left out as we start to recover from this crisis. I want to take a minute to thank one community leader who has taken to heart the meaning of proactively caring for others. Thomas Tull, a distinguished Pennsylvanian and very generous Pennsylvanian. He's an investor in the scrubs and medical apparel company Figs, and he's generously donated $4.2 million to equip hospitals targeting black populations. This is in honor of Jackie Robinson Day, which is today. This is an incredible gift, and it's one I hope inspires others during this time of incredible need. We all need to continue to work together to get through this pandemic. We need to continue to care for one another. We need to continue to support each other. And we need to continue to be mindful of how our actions affect others. We've come so far together, and I'm asking everyone to stay strong, stay the course until we get through this peak phase. We'll soon be moving into a reopening phase, but for now, we need to continue staying home as much as possible. That's what's best for everyone, including ourselves. Thank you. Now let me turn it back over to April for questions.
Thank you, Governor. Our first question is for you from ABC 27. Senate Republicans introduced a bill that would allow county commissioners to decide when to reopen their counties. They argue that rural counties like Perry and Juniata, which don't have a lot of cases and have natural social distancing, should be able to get back to business. What's your reaction to that?
Yeah, I don't support that bill. I think everybody, including the folks who authored and passed that bill, are looking to the next phase, and we all want to get there as quickly as possible. But I think this is something that we all need to do as a Commonwealth, and so I have a concern about handing over the responsibility for opening up, especially in places where we might not be perfectly ready. Pennsylvania is flattening the curve right now, and we're flattening it because everywhere, all across Pennsylvania, we're working together to stay at home, to do the things we need to do. We all need to continue to work together to make sure that we get through this the way we should.
Governor, we have several questions from reporters related to Senate Bill 613 from the Capitol Star, Inquirer, NBC 10, CBS 3, WJAC, and KDKA. The questions are around this topic. In terms of having the House and Senate Republicans are saying that you use a very narrow definition of what is an essential business in the state. You, on the other hand, are relying on your health secretary and other health officials for that guidance. What do you make of the legislative efforts to restrict your authority in this regard? And will you veto legislation that seeks to open up businesses before you're ready to do so?
Yeah, actually, we're using, I think, common sense. We're trying to distinguish between essential and non-essential businesses, and uniquely in Pennsylvania, unlike other states and the nation, we're not just handing out a list and saying this is the way it is. We've actually created a waiver program that over 40,000 businesses took advantage of. So we're trying to do everything we can to make sure that we are keeping Pennsylvanians safe, and that we're doing that by staying home. And making sure that the businesses that remain open are absolutely essential. The better job we do here, the sooner we're going to get through this phase and the safer we're going to keep Pennsylvanians. So I think what we need to do is recognize that the course we're on right now is the least bad choice we have to make, and with all the painful decisions that go along with it, it's the right course for Pennsylvania.
The next question is for Secretary Levine. From the Beaver County Times, Based on the hospital financial report released by PHC4 today, I'm interested in why the percentage of uncompensated care is so high and how that likely will be significantly higher after this pandemic.
So as for that report, they highlighted that this was before the COVID-19. And so I don't have an explanation for why that data was higher. But the federal government has said that hospitals will be reimbursed by the federal government for care of patients with COVID-19 that don't have insurance. And so I think that won't be an issue in terms of this global pandemic in regards to hospitalization.
Secretary, we have multiple questions about a proposed testing site at Mohegan Sun Arena near Wilkesboro. There are some concerns about it's in an area where there are many shops and restaurants, and that is this actually the location, and were other locations considered?
So we have worked very carefully with the Department of Health, with the Pennsylvania Emergency Management Agency, directed by Director Padfield, and so we have determined that this is the best place to hold this mass testing site. There are extensive plans in terms of how to route traffic, etc., so that the throughput will be fine, and so we feel very strongly that this is a really good place to have this mass testing site, and we're hoping that we can announce, pretty soon when that's going to open.
From the Citizens' Voice, Senator Yudichak issued a statement saying that the health department failed to consult local authorities on the proposed testing site. If it's accurate, why didn't the health department contact first responders and healthcare providers?
Mm-hmm. So again, in collaboration with the Pennsylvania Emergency Management Agency, both of us have had extensive contact with local authorities about this site, and many, many, many phone calls. And we very much appreciate the Senator's support for all of our efforts.
Secretary, from WJAC, we've heard from residents that received COVID-19 tests that their tests are being sent to out-of-state lab sites. Do you think that's the best option for Pennsylvania test sites to be doing when we're trying to get quick results?
Mm-hmm. So there are a number of different ways that testing has occurred in Pennsylvania. We have had laboratory testing done at our state lab in Exton, and we have prioritized certain communities for that testing, such as healthcare providers and the long-term care living facilities that I was referencing earlier. And we are able to do approximately a 24-hour turnaround. We know that many of our hospitals have developed their own testing capacity, and they usually have an efficient turnaround. But much of the tests that are being done are sent to commercial laboratories such as Quest and LabCorp. We need to take advantage of all available testing capacity really throughout the country, and we would not be able to do the amount of testing that we have done to date without the use of Quest and LabCorp. We do realize that there has been a lag time from the time that the test is taken to the time that the results come in from those commercial laboratories. Of course, those laboratories are nationwide, and so there's a lot of challenges there. But we have called those laboratories, and we're working with them, and we'll do anything we can to help them with that lag time. We want to take advantage of every opportunity to expand testing in Pennsylvania.
Thank you, Secretary. The next question is for Governor Wolf. From the Tribune Review, today in his daily briefing, Governor Cuomo outlined some factors that his administration will take into consideration for reopening the economy. He gave specifics like how they will analyze the rate of spread, contact tracing, which businesses would be the first to open, and what residents would be required to do in public. Do you have plans to introduce similar reopening outline with those specifics?
Yes, as I mentioned on Monday night in my presentation to the people of Pennsylvania, that's something that we have to do, and I laid out the elements, and it does include how we're doing in terms of new cases and how we're doing in terms of staying within the capacity of our healthcare system to treat victims of COVID-19. We also, I think, need to look at the capacity of the system to provide tests, either surveillance testing or antibody testing. And I promised on Monday night, and I continue to promise, that we will come up with specific guidelines as quickly as we can.
Governor, from CBS 3, people are having issues getting their unemployment claims approved. What help is out there for folks who need help now?
That is we have 1.3 million unemployment compensation initial claims that have come in just in the last 2.5 weeks, and that is stretching the capacity of the system in ways that we've never seen before. So what we're doing is to do everything we can to bring more people into the call center, to invest in new technology, which we've already done and implemented to make sure that we can turn requests around more quickly. We've added staff to our mailrooms so that we can get checks out faster. We are not there yet. I readily admit, and the wait time is still too long. But we are committed to doing everything we can to improve that, and we will work tirelessly every day of every week to make sure that we do what we need to do to turn these applications around as quickly as possible.
Governor, as a follow-up to that, WTAE asks, an independent study projects that the Unemployment Compensation Trust Fund will run out of money in 11 weeks. How much do you expect to need to borrow to keep the fund afloat, and how much more taxes will businesses have to pay down the road?
I'm expecting that we're neither going to borrow or tax, that this is a pattern that has happened as a result of the COVID-19 pandemic, and it's affecting every state, every municipality all across the country. And so it's one of the main reasons that the federal government has stepped in. That's where the money is going to be coming from to fund unemployment relief. And the Unemployment Compensation Trust Fund was never set up for this kind of activity. But it's also where the additional $600 per week is going to come from the federal government. So I see the federal government, the stimulus packages, the CARES Acts that have already been passed, and some that may soon be passed, as the salvation of our unemployment compensation system.
And Governor, from the Philadelphia Inquirer, many of the Pennsylvanians still permitted to work in person have low and working class incomes. An analysis of the state's life-sustaining businesses shows that a quarter of those workers make less than $30,000 annually, and 2/3 make less than the state's household medium. What's the Wolf administration doing to keep those workers safe and ensure that they are fairly compensated for risking their safety to benefit those of us sheltering at home?
Well, there are a couple aspects to that question. The first is we just announced, Secretary Levine and I announced that we have taken specific steps to safeguard the health of workers in each of those categories. We are also urging employers to pay their employees commensurate with the risks that they're all taking. Many of us have heard advertisements from companies like Amazon that are hiring people on the spot and employing them day by day and giving bonuses for people to come to work. So we need to do all these things. This is a tough time, as I said, for people. It's one of actually a very interesting cautionary tale in terms of how fast we can actually get our economy up and running. We need to make sure that we give employees the confidence that they can come to work. We need to make sure that we're providing the compensation, and this is, since most of the jobs are in the private sector, that's the responsibility of the private sector. We need to make sure that customers feel safe coming and buying things. And we need to make sure that owners have the confidence that the economy really is in shape, and that their customers and their employees are going to be healthy. These are things that we've been working on for the last 4.5 weeks, and the Commonwealth will continue to work on those things to make sure that Pennsylvania is set and confident that we can get back to work.
Thank you, Governor. The next question is for Secretary Levine. From WNEP, we're hearing from many viewers questioning the state's daily numbers of people who have tested positive, especially since the Lehigh Valley Health Network announced it's going to be doing less testing, and its coverage area includes hotspots of Hazleton, Poconos, and Lehigh Valley. Does that health system's change in testing protocols help account for the lower number of new cases per day in Pennsylvania?
No, we're doing everything we can to expand testing in Pennsylvania. We realize that there have been challenges. First, over the weekend, the testing site in Montgomery County and Philadelphia had to close, although the one in Montgomery County has just reopened today. And then, as we said, we'll be opening up the testing site at the Mohegan Sun. So we're looking to expand testing. We actually just spoke with the director of Lehigh Valley Health Network today about testing, and we were informed that they are getting more reagents and more testing supplies and hope to ramp up testing over the next week or so. So we're very pleased with that, and we're going to be looking to expand testing throughout Pennsylvania as much as we possibly can. There are still challenges accessing the reagents and the supplies for that testing, but we are working as hard as we can to get those reagents for our facility in Exton, and then to help health systems get the reagents they need to do their own testing.
From PBS 39, Secretary, have all healthcare facilities complied with the deadline to submit supply and equipment inventories to PEMA? And has the state targeted or has it considered moving any of its resources at this point from one place out of to another?
So we're having great cooperation with our hospitals and health systems, as well as the Hospital Association with that order. And the executive order that the governor instituted previously was really an order of last resort, that if we were seeing a surge of cases that was overwhelming our health system in a certain area, that the governor had the authority to move assets and resources if necessary. But we're hoping not to have to do that at all. And as the governor said, we have been changing that curve so that we are not overwhelming the health system at that time, at this time. And so, so far, so good. We're coping well.
Secretary, from WBRE, other states are beginning efforts to start contact tracing. Is Pennsylvania making similar plans? And if so, what methods will be used to track contact between those who tested positive and other members of the community?
So that is correct. So, with the measured approach that the governor had to the stay-at-home orders, the goal is to have a measured approach in terms of reopening that the governor has discussed to prevent a resurgence of this virus. So that will involve more testing. It'll involve determining who might be positive with COVID-19, instituting isolation, having contact tracing, and then instituting quarantines, and that'll be really important. So we're looking at different ways we might do that, some of it which might involve using volunteers in the public health world to allow us to expand our contact tracing individually, and also the use of technology, and we're considering a number of different technologies to help us do that.
Governor, our last question is for you. From PLS Reporter, have there been talks about some sort of temporary budget mechanism to hold the state over until tax revenues are clear after July 15th? Could the state do what New Jersey did and move the start of the fiscal year back?
We're obviously looking at not only the budget moving forward, the 2020-2021 budget, but also the budget we're in right now, the 19-20 budget. And we still have a quarter to go, 3 more months, almost 2.5 more months to go in this budget. So we are having conversations about how we're going to do that. Again, one of the big unknowns at this point remains what kind of money and in what form is the funding going to come from the federal government. Federal government in a situation like this where the economy is absolutely tanked is doing what the federal government should do, I think, and that is making sure businesses, banks, airlines have the liquidity they need. And I think they're looking at states in the same way. We need to have the capacity to administer the programs that the federal government wants to put out. We need to continue to do what we're doing to serve the needs of the people of Pennsylvania. And that's a budget issue that depends on the revenues that we have coming in. But in a period like this, where we have a huge economic meltdown, I think we'll be relying more on the federal government than we have in the past. So I think that's the issue that we're really looking at, and I think that's where the budget conversations are going to proceed.
Thank you so much, Governor. That concludes our briefing for today. Our next briefing will be tomorrow. Thank you.